Marketing of pharmaceuticals direct to consumers should be prohibited or more tightly regulated. With very minimal regulation in the United States, it has been shown that many people are deceived by pharmaceutical ads and are tricked into thinking they have an illness or that only one specific drug can treat their illness. This changes the doctor-to-patient relationship and results in overdiagnosis of conditions and inappropriate use of prescription drugs, where non-drug treatments are as effective or more effective. As a result, the overall cost of drugs and healthcare is driven up, without necessarily improving the health of those treated. If a non-truthful or unethical ad is released to market, it can be in the public domain for 15 days before the DDMAC requires it to be corrected. It is wrong to mislead someone regarding his or her health through emotionally manipulative tactics. An ethical DTC advertisement should educate the consumer about an illness without persuading them to believe that they have the illness and need the one specific drug to treat it. According to Hartman and Desjardins, who authored the Business Ethics textbook, to be ethically legitimate, an advertise should help autonomous individuals make informed choices, which contributes to market efficiency and overall happiness. Emotionally manipulating someone through an advertisement is unethical because it bypasses the person's autonomy. Overall, companies should focus the messages in their advertisements towards educating the public on different illnesses and disease while promoting their drug as a possible solution.
What's going on, everyone? My name is Keefe, and I'll be arguing that marketing of pharmaceuticals direct to consumers should be prohibited and more tightly regulated. So for the grounds, direct-to-consumer advertising is fundamentally emotional in style and downplays the adverse side effects of the product. So while the advertisements may be appealing, the potential serious side effects are concealed in the fine print of the ads. Also, countless DTC advertising campaigns will have pre-primed prescribers via a closely linked parallel promotional campaign. So as a result, overdiagnosis of conditions and inappropriate use of prescription drugs may occur. It is possible that non-drug treatments could be as effective or even more effective. So thus, DTC increases demand for new and more expensive drugs, even though those drugs may not necessarily be needed. As a result, DTC advertising unnecessarily increases the overall cost of healthcare without actually improving the health of those being treated. So for my warrant, it is unethical to exploit an individual's health situation. So while it is important for advertisers to make a profit off their campaign, they should not take advantage of individuals in poor health by claiming that their drug will heal their symptoms. Now for my backing. Advertisers should educate the consumer about the product, explain its positive and negative side effects, and then the consumer can make a decision about whether or not to purchase the product. So currently, advertisers are not doing a good enough job in educating the consumer about their products. In a survey that included 523 Colorado physicians and 261 national physicians, results indicate that the physicians believe that DTC advertising did not do enough to educate the consumer on the cost of the product, on alternative treatment options, or adverse side effects. Most also believe that DTC advertisements affected interactions with patients by lengthening clinical encounters, leading to patient requests for specific medications, and changing patient expectations of physicians' prescribing practices. Also, a study conducted by Dr. Dominic Frosch of UCLA concluded that while most ads made some factual claims and rational arguments for product use, few described condition causes or risk factors. The ads provided limited information about the causes of a disease or who may be at risk, individuals who have lost control of their social, emotional, or physical lives without the medication, and minimized the value of health promotion throughout lifestyle changes.